Actually, Assalamualaikum. We have finished half of it. If you have any questions from the previous half, welcome. What we have done up to now? Just a quick revision. We have done up till now the external nose, which has the root, then it has the dorsum, it has a tip or the apex. Then we have two skin fold, which is known as ala. Then we have an opening. Opening is known as nostril, anterior nares, or anterior nasal aperture, anterior nasal opening. All the names. Okay? Then we did with what is called as septum in the midline. Then I told you the difference between septum and the cavity. The cavity has an apex, roof. It has a floor. It has medial wall, which is the septum. It has a lateral wall, which is the lateral wall, and it's rough, irregular. It is covered with mucosa. If you dissect out the mucosa, you will find three elevations. Superior concha, which is the smallest, middle concha, and inferior concha. And then I gave you the concept that what is a concha? This is the lateral wall of my nose. Okay? This elevation, this is the concha. This bony part covered with mucosa is known as concha. Or the other name is turbinate. So we have superior turbinate, middle turbinate, inferior turbinate. Okay? Under every concha, when I say under, it means this part. Under this part, this is concha, this region is known as meatus. So, we have the smallest concha at the top, moderate size, and maximum large concha on the lower. Same is happening with the meatuses. The meatus is small here, moderate here, and the biggest meatus is here. Okay? Then I told you above the meatus, superior one, there is a depression. Yes, sphenoethmoidal recess. Why I am saying sphenoethmoidal? Because here is the sphenoid bone, here is the ethmoid bone, so it is sphenoethmoidal region. You can say it's a part, so sphenoethmoidal recess. And that is very easy to remember, that sphenoidal sinus will alatul directly open here. Am I clear?
Yes.
Good. We have done, what I have done yesterday is, I have repeated. If you have any queries, a simple question I can take and I can go forward. I hope everyone is good. Okay, let's go forward. Bismillah. Blood supply of the nasal cavity. Previously, we told you the blood supply of septum. Septum is in the midline. Some of the branches, of course, are common. But on the lateral side, we have these branches. Try to find the branches first and then their source. That will make your life understandable. Okay? So, the first is anterior ethmoidal artery, this region. Anterior ethmoidal artery. Then we have a posterior ethmoidal artery. It's very easy. They are anastomosing branches. Then we have artery from facial artery. Then we have palatine, greater and lesser palatine arteries, which are entering through palate, and they are anastomosing here inside. Then we have sphenopalatine artery, or the branches will go here, so the branches of sphenopalatine artery. Again, anterior and posterior ethmoidal artery from the top, anteriorly facial, posteriorly branches of sphenopalatine, and inferiorly palatine arteries. Now, try to find the sources that will make your life more easy. Anterior, posterior are branches for ophthalmic. Ophthalmic is a branch from internal carotid. Okay, so internal carotid is indirectly supplying here through the branches. Facial artery is a branch for external carotid. The greater palatine, lesser palatine, and sphenopalatine. They are also branches from external carotid. Intermediate branches are maxillary and sphenopalatine. Again, internal carotid will give ophthalmic, which will give two branches supply here. External carotid will give three branches here like facial, branches here like greater, lesser palatine, maxillary, and maxillary will give you sphenopalatine. And the branches of sphenopalatine will distribute the blood supply into it. Am I clear now?
Doctor, external carotid artery will give you maxillary, And maxillary will give you greater
Yes.
palatine with sphenopalatine.
Yes, like this. Like this, exactly. Clear now?
Yes.
Okay, so this is what we have in the blood supply. You can guess, there are two big vessels here. The carotid is the biggest vessel, almost a big vessel. So, if we have carotid, two internal and external carotid, they are anastomosing at the site of the nose with their branches. So, if there is a small trauma, bleed, dry nose, sometimes what happens? We pinch the nose through 2-3 times, especially in the cold weather. The mucosa is dry, it is ruptured, and you start bleeding. Reaf. You know reaf?
Yes.
Epistaxis. So, this is known as epistaxis. Or some trauma. Or some excessive vasodilatation. And you just pinch it. It's a common sight. The look is very horrible, but you can manage it very quickly. How? Like this. Bleeding from the nose is known as epistaxis. A very common site of epistaxis is this a good one?
Yes.
I just Google it. I don't know.
Yes.
Okay. And the anterior inferior part of the nasal septum here. This is the area where many branches from here, here, and here, they are anastomosing. What are the branches? These are the branches. They are anastomosing at this area known as Little's area and make a plexus. This plexus is known as Kieselbach's plexus. What is the importance of this plexus? Here is my septum, here is my septum. On both the sides I have a septum. If I pinch the nose frequently, even in hot weather because of dilatation, even in cold weather because of dryness. So if I pinch it more, this is the area which can bleed very easily. How to hold the bleed, how to help the patient? Pinch the nose from the tip, ask him to breathe through nose and relax him, sit. Once you press it for a while, it can stop.
Breathe through mouth.
Breathe through mouth till that time. So pinch the nose, breathe through mouth. This is the first aid. Then of course you can refer him to different areas. It will stop bleeding. It's common in children. They are playing with their nose most of the time. Trauma, they are learning to walk, they fall, this can happen. Understanding?
Yes.
Doctor,
There you go, yes.
little area is part of the plexus.
Little area is this area. Where is little area? Little area is anterior inferior part of the nose, nasal septum. Here we have a plexus or anastomosis, which is known as Kieselbach plexus. Sometimes they say bleeding from little area. So sometimes they take it like little area and Kieselbach plexus is the same because the site is same. Okay. This is how we remember it. These are the names of the arteries, first names of the arteries. This is the area and this is the site of bleeding. And I told you how to manage it very quickly. Am I clear?
Yes.
Okay. Venous drainage of the nose is very important. On the face, we have a very special area which is known as danger area of the face. That is this triangular danger area of the face. It includes the nose, whole of the nose, external nose. It includes the upper lip and the area between the philtrum and other areas. This is known as danger area of face. Why? Because if we have a boil, you know what is a boil? Sometimes we have white heads.
Yes.
They are staphylococcus infections of the skin glands or hair follicle. Their hair follicles are usually inflamed. They are known as boils, boil nose. Boil on this region or boil in the nose are very common because it's the dirtiest place. We clean it, we pinch it, we inhale through it. There are a lot of bacteria, there is a lot of hair in the vestibule, so it can get a boil. What is boil? Boil is the staphylococcus inflammation of the hair follicle. It can spread in immunocompromised patients, in severe diabetics, and other incidences. When we have, it will go, the infection can go back. Let's do the drainage first and then goes back where. So, the venous drainage is from venous plexus, which has drain into two parts, anterior and posterior. The anterior is bit safe. It will drain into facial vein. The posterior goes into pterygoid plexus of veins here. There is a pterygoid plexus of veins. The problem with pterygoid plexus of vein is that it has a connection direct with a cavernous sinus, which is in the center of the brain around the pituitary gland, which is known as cavernous sinus. It is a central sort of a sinus. Why I'm saying central? Because many of the sinuses, the dural venous sinuses of the brain, they drain or they are communicating with it. So infection can go rapidly to every area. Once it is infected, this can go into a process known as thrombosis of the cavernous sinus. So cavernous sinus thrombosis can be sometimes lethal. It can kill the patient. It's so dangerous. So any infection from here, face, a danger area of the face, can go back through pterygoid plexus and it can communicate with cavernous sinus, which can be thrombosed, and this is one of the pathologies or the clinical significances. This is how a person looks with cavernous sinus thrombosis. Very horrible look. He is unconscious, maybe comatose. The pupils are not reacting, maybe. And then we have, because with the cavernous sinus, we have many cranial nerves crossing through on the outer side, yes. So this is very important. If we see the real anatomy area illustration, here is the nose, pterygoid plexus of veins, and here is the cavernous sinus. Where is cavernous sinus? Cavernous sinus is actually, you have some idea of the pituitary fossa.
Yes.
On the two sides of pituitary fossa, there are two sinuses, one right and one left, cavernous sinus. Understanding?
Yes.
Okay. Once we will finish, I can demonstrate you the real area on the specimens. Nerve supply of nasal cavity. Most of the nerves and blood vessels have similar names, so you have to be careful. Uppermost part is for the smell. Smell is here, and it will go through olfactory, which is the first cranial nerve. How I remember the first cranial nerve? The nose is outside my face, so it is number one everywhere. So first olfactory is the one nerve which is responsible for smell. In situations like COVID or other areas, old age, damage to the nasal mucosa, atrophy of the nasal mucosa, this can go atrophy. And we can have a condition known as anosmia, no smell, or abnormal smell. So this is concerned with the uppermost part. The lower part, that is, even we call this as olfactory part. The lower part, which we known as respiratory part, general sensation is by trigeminal nerve. When I say general sensation, it means like any foreign body, any irritation, anything is. Upper anterior part, lower posterior part. You can divide it like this: upper anterior, lower posterior, and these are the branches supplying this area.
Doctor, the olfactory nerve, they undergo atrophy when you...
Yes, the fibers here. Actually, it is not the nerve which is atrophying, it is whole of the mucosa which is atrophying. So they are, since embedded in the mucosa, they may have some certain changes. Some infections like COVID, we have learned it now. Initially, it was very abnormal to explain to the students how a person cannot have a smell. Now, in the universe, everyone knows smell can be lost, especially in cases of COVID, when we have inflammation in the nose, or even the blockage can give you some degree of. Lateral wall, uppermost is for smell, of course. General sensation is by trigeminal nerve. Do you know what is this V1, V2, V3?
No.
Branches of the ophthalmic.
Trigeminal.
Trigeminal.
Trigeminal is the fifth cranial nerve, and we write number 5 like this in Romans. So V1 is the first branch of trigeminal. Trigeminal has 3 branches: V1, V2, V3. Ophthalmic, maxillary, mandibular. So whenever you find V1, it means ophthalmic. When you find V2, it means maxillary, and V3 is mandibular. We don't have mandibular here, okay? V1 and V2 are supplying.
So they all from the fifth cranial.
Fifth cranial nerve, trigeminal nerve. The name is trigeminal nerve. So the general sensation is by trigeminal nerve through 2 branches, ophthalmic and maxillary, which we label them sometimes as 5-1 and 5-2. This is not V1. Fifth one, yani first branch of trigeminal, second branch of trigeminal. And these are the branches, same like we have divided into anterior and posterior inferior part. This is for olfaction, yani smell. This is
General sensation.
yes, and this is for lightness. Am I clear?
Yes.
Doctor,
Yeah.
in the previous slide,
And okay, what? Let me go there.
the upper anterior is giving ethmoidal nerve, anterior ethmoidal.
Anterior ethmoidal branch from ophthalmic, yes.
Yes.
Clear now? Okay. Okay. in the sinuses, we finished the nose. What we have done in the nose very quickly? Just a quick revision. We have done the external nose, then we have done the cavity. The cavity is divided into two parts with the help of a septum. Here is the nasal septum. There is the nasal septum. So here we have one cavity, here another cavity. The roof of the cavity, the floor of the cavity, the lateral wall of the cavity. Here and here. The lateral wall has conchi and metastasis. The middle wall, the central wall is septum, which is partially bony and partially cartilaginous. And I will demonstrate you on the models later on where is bone, where is what, where is what. No worries. Then we have done the blood supply of the septum, the blood supply of lateral wall, the sinuses draining into the lateral wall. Then we have done Little's area, Kesselblash area, which is actually the site of bleeding in cases of epistaxis, which is known as bleeding from the nose. Am I clear?
Yes.
In the lateral wall of the nose, we have certain sinuses. All of them, they are known, the full name is paranasal air sinuses. Why we call them air sinuses? Because these are the pockets of air in the bones of the skull. Okay? See, for example, this is the maxilla bone, and here is open sinus. So there is a cavity inside of the bone. Not the medullary cavity, like we have cavity in the long bones like containing nikha, the bone marrow. Nikha is good for bone marrow?
Yeah.
Okay. So they have air spaces, they have respiratory mucosa, and they are connected to the lateral wall of the nose through certain openings. They are known as the opening of this sinus. And they are related to metastasis, as I already told you, but I will revise it quickly now. So, what are the paranasal air sinuses? These are the air-filled spaces inside the skull bones. Which skull bones? Frontal bone, frontal air sinus. Maxillary bone, maxillary air sinus. Ethmoidal bone, ethmoidal air sinus, sometimes called as ethmoidal air cells. 3. Anterior, middle and posterior. And all of them have a separate drainage, separate connection with the lateral wall of the nose. They are not connected. Anterior, middle and posterior, they are separately coming into the nose. There are 4 sinuses, as I told you: frontal, maxillary, sphenoid is a central bone. We cannot see from front, so we should need a side view. And they open into the lateral wall of the nose, all of them. They are lined by respiratory mucosa, remember this. They lighten the weight of the skull. I told you yesterday, they keep the skull light.
Yes.
And they give resonance. Once I have a flu-like symptom, if my sinus is involved, my sound changes. Agree? You can even diagnose from the phone that, oh, he has some sinusitis or something. They are either absent or rudimentary. Rudimentary means non-functional. They are mawjood, but they are not very functional at birth. But they increase in size as we grow up. They become fully developed after the eruption of permanent teeth. So these are fully developed after teeth. What they are and where they are, here is the side view. We can see all of them together. Okay, see from the front first. 2 frontal air sinuses. Why I am stressing upon air sinuses? Because we have dural venous sinuses in the brain as well, in the skull. So don't confuse, that is a separate entity. They have venous blood in it. They are in the cover of dura mater and the 2 layers of dura mater. They are there for drainage of, venous drainage of the brain and skull parts. These are air sinuses. They are related to the lateral wall of the nose. Here, frontal air sinus, they will drain into the nose laterally here. Then yellow are the sphenoid. Here, yellow is the sphenoid. The blue, we have labeled them also like this. The blue, anterior, middle and posterior, anterior, middle and posterior. And then maxillary air sinus, the largest, the biggest sinus. Because since the maxilla is the biggest bone in this region. Now one by one the sinuses. It occupies the most of the body of maxilla, maxillary air sinus. Each is pyramidal in shape. You know pyramid? Egyptian pyramids?
Yes.
They are like pyramidal in shape. The base is lateral to the wall of nose and apex towards the zygomatic bone. Here is a pyramid. Okay? Tilted like this. So towards the zygomatic bone. It's like this. The problem with this sinus is, suppose this is my maxillary air sinus like this. Okay? Like a pyramid. The drainage part is not on the dependent side. The drainage part or opening in the nose is on the superior part. So, The sinus opens into the hiatus semilunaris, middle meatus. This opening is near the roof of the sinus. If we have an opening in the roof of this room and we have full of fluid, will it be possible to drain? No. We should have an opening here. By nature, it is at higher risk of infection. Once the infection is inside or the mucosa inflamed, the drainage is difficult. I am not saying impossible, difficult. So that is the reason it's the most involved inflammatory changes sinus in the body. So the opening is near to the roof than the floor of the sinus. And this leads to a condition known as maxillary sinusitis, inflammation. The maxillary sinusitis is common because its drainage is difficult since the opening is near the roof, number one, and it is closely related to the teeth. Here is my maxillary sinus. Here is my maxillary teeth here and here. They have maxillary sockets in the maxilla, and a teeth is inserted. So if the root of the teeth is involved in any inflammation, it can give a sympathetic inflammation in the sinus. So these are the two reasons. Nerve supply, you know them. Superior alveolar nerves from maxillary nerve. Clearing hypothesis, pain from an infected sinus can be referred to the teeth or upper jaw. Teeth pain can go to sinus, sinus pain come to the teeth. So you have to be careful while diagnosing. The best thing is the nasal tone, or do a simple X-ray and you will find. I will show you X-ray later on. Frontal air sinus, here is the location. This is the frontal air sinus in the frontal bone.
Yes.
Two sinuses are usually unequal in size. Yani, right, maybe smaller or bigger than the left or vice versa. It can happen, no problem. Drain into the infundibulum, middle meatus. Here is the infundibulum. You can ask the Google map to take you there. Nerve supply is supraorbital nerve. Here is the frontal sinus. The pain in the head, forehead, is one of the causes frontal sinusitis. Ethmoidal air sinus, I told you, they are three in number: anterior, middle, and posterior. There are three sinuses. Some books say anterior ethmoidal air cells. Still okay. But if you remember like sinus, still no problem. They lie between the nasal cavity and the orbit. See their location. The blue area. Here is the orbit.
Yes.
The socket for the eye. And here is the blue area is ethmoidal air sinus. So they are very close to the anterior ethmoidal sinus, drain into the infundibulum. You know the drainage now. I have done you many times. Middle ethmoidal sinus drain into the top of the bulla ethmoidalis. You know this area. I will repeat it on the specimens. Posterior ethmoidal sinus drain into superior meatus. And nerve supply, anterior and posterior ethmoidal. This is the picture which is showing you sphenoethmoidal recess, superior meatus. Here, if you draw a straight line like this, you will find three of them: anterior, middle, and posterior, draining here. Anterior where? In the middle meatus. Middle where? Bulla. The posterior where? Superior meatus. What is this green? Is the frontal sinus from here.
Yes.
What is this sphenoidal sinus? Drain here. And this is not a sinus, this is a nasolacrimal duct, as I explained to you.
Yes.
There is a duct which brings you the tears
Inferior
from the nose, so excessive drainage is done here in the nose. Sphenoidal air sinus. It is present in the sphenoid bone. Where is sphenoid bone? Here is the sphenoid bone. This is sphenoid bone. All this is the sphenoid bone. This is sphenoid bone. In the sphenoid bone, there is a cavity, air-filled cavity, lined with nasal mucosa. This is known as sphenoid air sinus. Sometimes on X-ray, it has a very close relation here in this depression. In this relation, here is the pituitary gland. Okay?
Yes.
So, sometimes in the X-ray, you may be confused between this and this, so don't be confused. I will give you the trick. The sinus normally contains air, so it's obviously black. Everything on the X-ray is black, is the air. So, black, you should remember. This is sphenoidal air sinus, and the sphenoidal air sinus is related superiorly to the pituitary gland and laterally to the cavernous sinus. Okay, any questions up till now?
Doctor, the maxillary, it drain once it reach its maximum capacity, right?
It should, yes.
So
Or we should have the positional drainage of the sinus if we want to help the patient. or we can give some nasal sprays to dry it because they are inhaled into the sinuses as well, or we can give some antibiotics or something. Okay, pharynx. Everything is clear now?
Yes.
Okay. Pharynx. What is pharynx?
The
Tube.
connection,
Connection between here.
mouth and nose and
When I say tube, every tube is like this. They say this tube is deficient anteriorly. So let it make us deficient anteriorly. So now where to put this tube? Okay. So the tube is communicating anteriorly with the nasal cavity here. So this is nasopharynx. Oral cavity here. So oropharynx.
Yes.
And laryngeal cavity here. So laryngopharynx. And it will continue down as esophagus. Now the life is easy.
Yes.
Understanding?
Yes.
Both both are pharynx. The nasopharynx.
Three are pharynx.
And-
Laryngopharynx.
Yes. They are components of the pharynx.
Yes. What is pharynx? Pharynx is a white muscular tube situated behind the nose, mouth and larynx. Here is the tube. This is the tube. I told you this is like a tube. You understand this point? So this is a tube. It's communicating anteriorly. It's not wall here. It's communicating anteriorly. This all is pharynx. Pharynx has three parts. Nasopharynx, oropharynx, laryngopharynx. And it will continue down as esophagus. Here as I written, it's a common passage for air and food. Okay. But one at a time. Air and food, if they come together, you will start immediate cough. Extend from the base of the skull. Here is the base of the skull. The name is basi occiput, or you can say base of the skull, until it goes down at the level of cricoid cartilage. Here, one of the cartilage in the larynx, and it will communicate here with the level of C6 vertebra, cervical vertebra. Okay. From the base of the skull, lower border of cricoid cartilage, opposite C6, where it communicates, continues as esophagus, communicates anteriorly with the nasal cavity. So this part is known as nasopharynx. This part communicating with oral cavity, oropharynx. This part communicating with laryngeal cavity, laryngopharynx, and down it will continue as esophagus. Good?
So hypopharynx is the same as laryngopharynx.
Hypopharynx is same as the laryngopharynx. Yes, can be called. Okay, then
Finished.
parts, you know this.
Yes.
After that, I am sorry I cannot go in details.
Yes.
Why? Because this is a seminar topic.
Yes.
Plus, I have certain pictures to show you before going to the specimens. What is this all? Skull bone, frontal bone. In the frontal bone, you have this area. Frontal sinus.
Why is it a bit brighter?
Bit hazy, yani. It may be inflamed. Or it has less air as compared to other areas. Okay? When a sinus is filled with fluid, it is not black.
White.
Whitish. Okay? So here is the frontal. Where is the frontal sinus? Let me draw it.
The left bigger than right, right?
Yes, in this case. Of course, I told you they can have a variation. Understand now? Frontal. Now, where is orbit?
Orbit, the eyes.
This is eye orbit. This is eye orbit. Just close ethmoidal air sinus. Can you find a nasal septum?
Yes. In the middle.
very delicate.
This is straight or deviated?
Deviation.
Yes.
Slightly deviated to
To the
the
right.
Slightly deviated to this side. Okay. What is this?
Maxillary. Pyramidal shape.
Yes.
Yes.
Now you done.
Yes.
Now you see the pyramidal shape.
Yes.
Doctor, and you said the base. Where is the base?
I told you the apex is more related to the nose here, drainage,
This is
and
the
here is the
base.
base. Yes, this is the base. This is the apex, this is the base.
Base.
Now clear?
Yeah.
What is this HP?
Which way? Heart balance.
Yup, heart palate. Because it's visible like this, a bony part. What is OC?
Or cavity.
Yup, oral cavity. This X-ray was even tricky for me, so I make the key for you.
What is CG?
Crista Gili. Okay, Crista Gili. Crista galli is an elevation on the skull. I will show you here. Here. Here is the crista galli. So if I make it like this, crista galli is visible here. Crista galli.
Sphenoid sinus.
What?
What should be in the X-ray?
Where it should be in the X-ray? Will it be visible on side, on front view?
No.
We should have taken a lateral view. Yes.
Doctor, the area between the two frontal, what is it?
Nothing. The frontal bone.
If you go back, you will see.
Here. This is all frontal bone. So inside bone we have one sinus here, one sinus here.
Okay, let me go back to the.
Yeah, sure. Yes, here.
Yeah, so between this area.
This dark area, this is one of the sinuses. I draw it incompletely. Because I told you they can have a various shape. They vary in shape. And one can be bigger than the other. So it's part of maybe this or this. We have to do a lateral view and we should see that. Okay. What is this X-ray showing you? Deviated septum.
Yes.
What is this?
Hypertrophy.
This the orbit. Is this the orbit?
What is this?
Maxillary.
Maxillary septum.
Pyramidal.
What is this? A badly deviated septum. And can you see the concha? See the concha?
Yes.
Okay? Same as here.
Yes.
Nothing new. See the deviation of septum. See here. It's giving you a partial blockage. Thank you. I hope you enjoy learning.